Hello everyone, I have a patient of mine. She is actually pre-op, so this is one of the first few ones that I'm doing where I'm actually talking to the patient. Why are you here today? Like, what is the reason why you want to undergo this surgery, which is removal of the implant plus the capsule?
I've been searching for 3 years to find what's wrong with me. I've been to multiple physicians. Nobody can figure out what's wrong with me. I've had echo, EKG. I'm an ICU nurse. I went down the rabbit hole and I came to breast implant illness. My main symptom is fatigue and brain fog, joint pain, abdominal issues. My eyes hurt. I have very bad sensitivity to light. That's to start.
Sure. Now, when did this start for you? Because you've had implants now 6 years.
I think it may have started right away and I didn't notice it. I was actually on a medicine I was on an upper, an Adderall. I actually started taking more of it and I really think it's because the fatigue of the implant. So my symptoms, I would say, started 3 to 4 years ago, really bad.
Okay, got it. Now, what made you come now, like 3 years later? Like, what was it that was kind of the pushing force for you, if you will?
I can't go to work. I can't think in the ICU. I can barely take care of my kids. I want to sleep all day. The depression, new anxiety, things I've never felt before in my entire life.
For someone who's only 33, very young, and you have all these signs and symptoms, pretty much almost all the boxes checked off in the questionnaire. Now, tomorrow, as you will see, as we discussed, the goal is to make the cut right in the crease. You have what is significant bottoming out plus lateralization of both the implants. I'm going to remove that excess skin that's going to help with the contouring. And then I'm going to remove the entire implant capsule plus all that inflamed tissue, send that off to pathology, take cultures, and then I'd love to hear from you post-op to see what and how your symptoms are. You know, I get this question asked a lot, what and how many patients improve, just like you asked me, and I'll tell you well over 90% of the patients only feel better and recover from the many symptoms of breast implant illness. So we'll continue to basically go over and see how your improvement and kind of follow you along. Anything you want to tell to any other patient who's thinking about explant surgery?
I think it's probably, I'll find out tomorrow for sure, but I think it's probably if you checked all the boxes off, all your labs are negative, you've done everything you can do, it's last ditch effort, I would
Right. Now remember, you have gone through the whole battery of tests. Yes. You have gone through all these subspecialists.
Spent thousands and thousands of dollars.
Right. Now we know it's not lupus, it's not rheumatoid arthritis, it's not the thyroid, it's not your other endocrine problems or issues, adrenal. So we know by default more and more of the fingers are pointing towards what is breast implant. Now it's a very typical story. There is no lab workup, there is no imaging. And this is all what is the pattern on that symptom questionnaire that basically points towards and highlights what is breast implant illness. Now, thanks for sharing your pre-op journey, and then we'll continue to follow along and see how you're doing.
Thank you.